Hey guys, welcome back to McDonough Coaching for all things physio, exercise, nutrition, and habit forming. And today's video is on back pain. So when my patients ask me, do I need a scan? Um, if they haven't done any significant amount of physiotherapy, I say obviously no. Because the main reason is MRIs don't correlate to the patient's pain. So for example, I'm treating two patients right now. Or I've just finished treating one. A lady who's in her 80s who has what we call degenerative or arthritic changes in her spine. So causing thinning of her vertebra at multiple levels. So her MRI looks terrible. But she's got little to no back pain, and if she exercises regularly, she has no back pain at all. And then I've got another chap where he's had an MRI and it showed absolutely nothing wrong with his back, and he's in chronic pain. So that's why we always say treat the man, not the scan. Yeah, easy to remember. So to explain so you got your what we call non-specific lower back pain, which is kind of your, let's say that's like your 95% of back pain, or 90%, give or take. And then you've got bulging or herniated discs, which I'm going to explain, which is about, 4%, 4.5 I'd say, or even. And then you've got a very tiny amount, which might be a tumor or some sort of cancer. Yeah, but that percentage is tiny. Yeah. So if we go over here, so you got your vertebra, and then in the green is your disc. Yeah. So you got a nice big fat disc. With a bulging disc, the disc is just bulging out and compressing on the nerves. So you can see down here, hopefully. So that's the vertebra there. So looking at a cross section, that's your disc in green, and the disc is bulging out, and that might cause some compression if I had another marker, some compression on. So there are all your nerves. As the nerve comes out of your back, the disc can sometimes bulge onto it. And then when you have a herniated disc, you get the nucleus inside comes out. And usually, well, again, sometimes with a herniated disc, you can have more significant back pain. So people with non-specific, usually it tends to just be, it's localized to the lower back, radiating pain through the bum or the back of the legs. The bulging or herniated discs, more common, well, when it's more severe, then it comes down into the bum and the back of and sometimes the back or side of the legs. And very commonly it's just bulging to one side, and you get those sciatica type symptoms. Yeah, and then the last one is where the disc is thinning, or you get degeneration, degenerative spine. So you get the very thin disc, and sometimes that can cause compression on the nerve as well. And then you can also get like little osteophytes that form, so little bony growth. So where you have nice clean cartilage and any bone, that can get worn down, so that smooth surface then becomes a bit rough with these little bumps, which are called osteophytes. And that's basically back pain explained. But again, you don't, if I would say if you've had 2 months, 2 to 3 months at least of physiotherapy, you've been compliant with your home exercise program, you have some manual therapy, and you've had no improvement, then maybe speak to your physio or GP to get a referral for a scan. If you're obviously improving, then just continue with physiotherapy. So then the first port of call usually is to see a spinal or orthopedic consultant, and then they will assess and then suggest whether X-ray or MRI. Usually they'll probably go on an MRI first, because X-rays only look at bones. All right, cool. Like, comment, share.